We know that there's a constant demand throughout the week from our patients who are wanting to access their GP, many of which will be with minor ailments which could be more suitably addressed in a community pharmacy. And we estimated that to being between 5 and 10% of our daily contacts, which we could appropriately signpost from primary care to a community pharmacy for help instead of using our GPs.
I think that my main fear was not being treated seriously by the patients, and I wasn't sure whether they're going to be happy to be referred to a pharmacist as opposed to seeing their own GP.
Our fears at the start were that the reception team might not be able to pick up on the sorts of complaints which would be appropriately signposted, but actually with a very small amount of training they were able to easily identify the sort of problems that were suitably dealt with in a community pharmacy rather than in GP surgery.
Our patients initially looked at this service, and I actually positioned it on our social media. I thought it was a really good way of trying to put it out there first to tell them what we were doing. And actually the feedback was really good. You know, here I was telling them that I'm not going to give them a GP appointment, I'm going to direct them somewhere else. But actually the feedback, and I think it was seen, about 4,000 people saw it, and I think I had one piece of negative feedback, and another patient immediately went in and responded to it. I don't even have to respond. And the patients are getting seen the same day.
We're currently sending maybe 3 or 5 patients a day, and I'd say 70 or 80% of those are resolved within the community pharmacy.
We referred over with as much information as possible to help the pharmacist. And what we have found is that we get information back just as effectively too. And we will also get the emergency phone calls come through if we need to see a patient that day. It's worked really, really well. This new service has meant a great deal to our surgery team. It has allowed us to free up appointments, to enable our GPs to be able to focus on the more complex cases.
I've realised that patients really enjoy interacting with the pharmacist. They treat us very seriously over here. They're very, very thankful for the advice that we give them.
Anything that we can do to reduce our daily demand and manage the more complex patients rather than perhaps some of the minor illness, I think is really valuable for general practice.